All right, so here's another Reddit post on a telehealth, and this one is asking a question about cross-state or interstate telehealth, and it's in the section called Therapists. It's a special community specifically for mental health professionals. So this is a mental health professional asking a question about a client who's going to go across state. So it reads, Happy Friday. Can anyone point to a regulation that states whether or not you can provide telehealth services to a patient physically present in another state? For reference, I'm licensed in Maryland and my client would like to have a session while she's traveling briefly to another U.S. state. We use the platform ZocDoc, and I guess on the client-facing side, it says you have to be in Maryland. Looking for a specific law or regulation, not looking for folks to just let it slide because we've already discussed the travel at length and it's past the point of plausible deniability, and I'm not comfortable with that. All right, I'm reading this post because you might find yourself in this situation where you are using a mental health professional for therapy, but you're traveling or you've moved and you want to keep your same mental health professional. There's a few responses to this original poster that state the fact that in reference to the mental health professional, if the client is in a different state, they have to be licensed in the same state that the client is in. And that's true. I'm going to add that since the pandemic, individual states as well as the federal government have really tried to grow the reach of telehealth. They really want people to have the access that they would not otherwise have using telehealth. And so they've really tried to evolve these license agreements with mental health professionals in the form of something called an interstate compact. And that basically means that the paperwork that it really requires to get your license in the individual states is a lot. But if you do these interstate compacts, it reduces that. You apply for one license and that's effective in multiple states. And if you're really curious, you can check out the Center for Connected Health Policy. It's a great resource that's funded by your tax dollars, the Health Resources and Service Administration. I think in general, it's just worth having a conversation with your therapist about your travel plans just to make sure that your therapist is covered and you're protected. This is a great question. Subscribe to the podcast, join our newsletter to get more information.